The rubella virus is an important togavirus, which is a positive sense RNA virus family. The disease that rubella virus causes is called German measles because it presents very similar to the disease of measles. Patients that are infected with rubella, usually children, suffer from fever, a post-auricular or behind the ears rash, lymphadenopathy, arthralgias, and a rash that spreads from the head and neck down to the trunk. So it begins in the head and goes down the body to the trunk. It's the key features of the German measles. Here we can see a very typical rash caused by the rubella virus. You can see it starts here kind of in the neck and head region near the ear, and then it spreads downward to the body and arms. In children, German measles is generally a mild disease that resolves on its own. However, the rubella virus is not always a benign virus. In patients that are pregnant, it can be very dangerous. If the virus infects a pregnant mom, the virus can spread to the fetus and cause a severe congenital disease. It actually represents the letter R in the Torch's mnemonic that lists the important congenital diseases. If we think back to our microbiology lectures, do you remember the characteristics of congenital rubella syndrome? Congenital rubella syndrome is characterized by deafness, blindness, heart and brain congenital defects, as well as a diffuse petechial rash. As we can see here in this image, you can see the petechiae covering the face and spreading down into the trunk. Fortunately, we have a vaccine, a very effective vaccine that can prevent rubella virus infection. This is the MMR vaccine, which represents measles, mumps, and rubella. It is a live, attenuated vaccine. It's very important for protection against viral infections of measles, mumps, and rubella.